Joint basic principles. Connection between two bones. Solid joints are tightly connected to provide structural strength. For example, cranial sutures. Synovial joints have a joint space to allow for motion. Articular surface of adjoining bones is made of hyaline cartilage type 2 collagen that is surrounded by a joint capsule. Synovium lining the joint capsule secretes fluid rich in hyaluronic acid to lubricate the joint and facilitate smooth motion. Number 2. Degenerative joint disease. Osteoarthritis. Progressive degeneration of articular cartilage, most common type of arthritis, most often due to wear and tear. Major risk factors is age, common after 60 years. Additional risk factors include obesity and trauma. Affects a limited number of joints. Oligoarticular hips, lower lumbar spine, knees, and the distal interphalangeal joints (DIP) and proximal interphalangeal joints (PIP) of fingers are common sites. Classic presentation is joint stiffness in the morning that worsens during the day. Pathologic features include disruption of the cartilage that lines the articular surface, as you can see in figure at 18.7, degenerative joint disease. The disruption of the cartilage occurs. Fragments of cartilage floating in the joint space are called joint mice. Aburination of the subchondral bone. Osteophyte formation, reactive bony outgrowths, classically arises in the DIP Heberden nodes and PIP Burkitt's nodes, joints of the fingers. Number 3. Rheumatoid arthritis. Chronic systemic autoimmune disease. Classically arises in women of late childbearing age, associated with HLA-DR4, characterized by involvement of joints. Hallmark is synovitis leading to formation of a pannus, inflamed granulation tissue, leads to destruction of cartilage and ankylosis, fusion of the joint. Clinical features: arthritis with morning stiffness that improves with activity, symmetric involvement of PIP joints of the fingers, swan neck deformity, wrist ulnar deviations, elbow, ankles, and knees is characteristic. DIP is usually spared, unlike osteoarthritis. Joint space narrowing, loss of cartilage, and osteopenia are seen